Now, one local medical practitioner is suggesting that where possible, athletes who have tested positive for COVID-19 should do an ECG before being allowed to represent the country. Renata Brown tells us more.
In September, researchers from Ohio State published data that suggests up to 15% of healthy college athletes show signs of heart inflammation after recovering from COVID-19. It has led to the NCAA suggesting that athletes recovering from the virus do an ECG before returning to play. Jamaican sports medicine specialist Dr. Paul Wright explains the reason behind this move.
Once you are infected, it then goes on to affect different parts of the body. We know this because months after people have tested positive, they start turning up in doctors' offices and in hospitals with bizarre symptoms, some of which can be listed as myocarditis, brain fog, being sleepy all the time, pain in the joint. Is a whole gamut of symptoms that are being presented.
Dr. Wright is also urging the government to play its part in identifying national representatives who may have contracted the virus.
I am hoping, and I haven't seen any evidence of that the government, through the Ministry of Health and Wellness, is putting a database of the people who are tested positive. Because what we know is that the present scenario in Jamaica is that they are not really testing asymptomatic people. And we don't know what is going to happen to you in the long term. We can't send everybody who is coming into the sporting arena to do all these tests.
Wright says associations must also do their part to protect athletes.
They are requesting to have a pre-participation evaluation before you come into sport. Then the ECG and some enzymes will be done as part of this evaluation, and anything unusual in the ECG, you'll be then sent to a cardiologist. So there are ways of making sure that this can happen, and I think that the only way to do that is to get that database of all the people who are positive, so you can follow them, and anybody who is going to be involved in competitive sport must be tested for coronavirus before being allowed to compete with other people.
As at Monday, November 2, Jamaica had 4,289 active cases. Of its 9,257 total COVID-19 confirmed cases, with 210 deaths. Renata Brown for TVJ Sports.